I'm Dr. Kwesi Djokoto, the Deputy Director of Public Health for the Volta Region. I work under the direct supervision of the Regional Director of Health Services, who is Dr. Timothy Lecha. And when it comes to COVID in the Volta Region, we have been collaborating with a number of stakeholders. And we have a committee in place. That's the Regional Public Health Emergency Management Committee, which is made up of the Information Services Department, the police, the BNI, the military, environmental health, Red Cross, and so many other religious groups, traditional leaders. They come together and form this umbrella body, which we call the Public Health Emergency Management Committee. And that committee is chaired by the Honorable Regional Minister. My personal role in the committee is to represent the Regional Director of Health Services most of the time as the technical lead for the committee. Because pandemic obviously is a health condition, so the health service is supposed to play a pivotal role. And as the Deputy Director of Public Health, working under the direct supervision of the Regional Director of Health Services, I'm supposed to be mobilize all our human resources from surveillance to clinical care to infection prevention and control, and all other aspects of health to ensure that we have a holistic approach towards our fight against COVID-19 in the Volta region. So in the Volta region, so far, we have reported 10 cases, and 6 of those came out of mandatory quarantine. We have had 84 people on mandatory quarantine in the last 6 weeks. And so far, 77 results have been received from the 84 people who have been quarantined. And out of that, 6 of them came out positive. So if you want to calculate it per percentage, then that's about 7%. And when it comes to routine surveillance, we have so far suspected 133 people. And out of the 133 people, we have received results for 60 of them. Out of the 60, 4 people have turned out positive and 56 of them negative. You'd have noticed that about 73 of the labs are still pending. And thankfully, from Monday, the 27th of April, we are going to run tests at the University of Health and Allied Sciences Laboratory. So the challenge we have with pending results would be resolved within the week. Out of the 10 cases that have been reported, a total of 524 people have been identified under our enhanced contact tracing regime. And then so far, all of them are under self-quarantine. We have taken their samples and we are still awaiting results. All 10 cases are in our regional treatment center, and they are all doing very well. They are responding to treatment, and within this week we are going to repeat their tests, and if it comes out negative on 2 consecutive times, then they will be discharged. So hopefully I can safely project that by next week, by the end of next week, we could be seeing some people being discharged from the isolation centers. So the capacity of the region to detect, isolate, and properly manage all cases of COVID-19, including those who are suspected, has increased tremendously over the past 6 weeks. All the 500 facilities that we have in the region currently have holding areas. That is where they keep suspected cases. In addition to that, all district hospitals and private hospitals also have isolation centers. So when a case is suspected, you're expected to keep the case there until you get feedback of what the results are. If it turns out positive, then you are sent to the treatment centers in the region. In the Volta region, our treatment centers are the Ketu South Municipal Hospital, the Hohoi Municipal Hospital, Bator Catholic Hospital, and the Whole Teaching Hospital. Together, we have a capacity of close to 80 beds because the Whole Teaching Hospital has 40 beds, Ketu South has 10 beds, Hohoi has 10 beds, and the Bator Catholic Hospital also has 10 beds. So that we have a total capacity of 80 beds. But I must hasten to add that depending on the situation, more isolation centers would be quickly upgraded to treatment centers where they can also keep positive cases and appropriately manage them. All our health workers, especially beginning from the rapid response teams, have been trained. Every hospital has a case management team, and they have all been trained. All the staff have been sensitized about the management of COVID-19. So they have the capacity to manage suspected and confirmed cases of COVID-19 in the Volta region. The welfare of the staff in the Volta region, as well as in the whole country, is of paramount interest. Because one thing that the COVID-19 can do is to sharply deplete your human resource personnel strength. When they come into contact with patients and they are not well protected, when the patient tests positive, that means everybody who was involved in the management of the client would have to be quarantined. And if this happens, that means the next patients who will come will not have doctors or nurses to attend to him or her. So therefore, it is extremely important that we take extremely good care of all our health workers. So what has been done is firstly to empower them, engage them with the appropriate education, how to manage such cases, how to even use personal protective equipment. So all these have been done. And then we have made it a point to supply personal protective equipment to all the districts, so that the health workers will be confident and feel comfortable when they are working with clients. And in this regard, I would want to thank very much the Ghana Health Service, the Ministry of Health, and private individuals, the assemblies, the members of parliament, prominent chiefs, prominent individuals in the country, who have even also come to further fortify the fight against COVID-19 by donating hand washing apparatus, by donating personal protective equipment. Nobody knows how long this is going to last. But what is important is that at every point in time, we ought to be ready. We ought to have a lot of these things in stock. In addition to that, like you heard in one of the president's address, all health workers are supposed to be given tax holidays for the next 3 months, for the months of April, May, and June. So tax rebate for all health workers. And this is also supposed to boost their morale, because we understand that in this day and age, they are at more risk. If you look at the number of health workers in other countries who have been taken ill and unfortunately died, you will notice the kind of risk that health workers face. So I believe that is, in this light, that is why the president took this particular decision. In addition to that, the health workers who will be working in treatment centers, they are going to get 50% of their income paid to them as allowance for the next 3 months. And I'm sure it is going to be reviewed when it is necessary. So collectively, all this package will go a long way to boost the morale of all health workers. But what is also very important is that every health worker swore an oath to put him or herself, or making him or herself available to the people, to serve the people at all times. So we are also driven by that intrinsic need to ensure that the public is safe, to ensure that we offer good treatment and take absolute good care of all our clients that we see. So together we are sure that we are ready to take care of all clients that we see in our various facilities. At present, yes, certainly some health workers have been exposed, and some of them are under self quarantine. But till date, no health worker has tested positive for COVID-19 in the Volta region. So there are several directives that have been given, and I'm sure that we are very much aware that they are not supposed to be workshops. We are not supposed to have conferences, no festivals, no funerals, no weddings, no sporting activities, no political activities. To that extent, I don't think that we have met much resistance from the citizens in the Volta region. Hardly would you ever hear that anybody has gone against the rules to organize any of these activities. And in the few instances that some people have tried to organize church services, it has been brought to the attention of the law enforcement officers, and adequate action has been taken so that it serves as a deterrent to people who would want to go down that path. There are other directives as well, that all stores are supposed to ensure that we have enhanced hygienic practices over there. So most of the stores, when you enter, from pharmacy shops to supermarkets and to hardware shops, you notice that they have what we call the Veronica buckets with running water and soap, and with somebody standing by the Veronica bucket. They ensure that you wash your hands well before you enter the shop. And some even, in addition to washing your hands, they will even give you hand sanitizers before you enter. So that's much. We'll say that we have received a lot of cooperation from the people in the Volta region. Now, another directive that was given was that the Ministry of Local Government and Rural Development, they are supposed to work with all municipal district MMDAs to ensure that marketplaces are not overcrowded. And I would say that that has been one of the most challenging aspects of managing COVID-19 in the Volta region, because food is a matter of survival. Everybody needs to take in food in order to survive. So definitely people will still go to the markets to buy things. It is a necessity. Several strategies have been put in place. And in some instances, unfortunately, after engaging all the stakeholders, some markets had to be closed. And in some instances, the market days, which are specific days reserved for particular communities where people from all over the region come to trade, has been reviewed. So instead of reserving one day, now every single day is supposed to be a semblance of a market day. So you can go and buy whatever you want at any point in time. So if you have fewer people in the markets, then we are sure that we are not going to be overcrowded in our market. Now, the next step is to also ensure that we segment the various markets, or the various products that are sold in the markets. So if somebody sells plantain, we can allocate one place for all those who want to sell and buy plantain to go to. We can also look at other areas. So those who sell grains, rice, beans, and so on and so forth, you go to another location. And when this is also done, it is also going to reduce the pressure in our markets. So engagements are still ongoing. The regional minister, the municipal chief executives are continuously engaging the market queens and other people to ensure that there is appropriate social distancing in our markets. Now, with the president's directive encouraging everybody to also wear masks, now if you go to the markets, you'll see that an increased number of people are wearing masks. We believe that when we intensify education on the use of masks, that is also going to support our fight against COVID-19, because the mask is a mechanical barrier which prevents the viral particles from being inhaled. Or if that person happens to have COVID-19, it will prevent that person from further shedding the virus to other people who are also close to him or her. We are actually in the process of analyzing our data, and we have certain pointers that are not very encouraged, because we have noticed, it's not only in the Volta region, but in most places in the country, that people are no more attending hospitals. So the OPD attendance has dropped. The question you'd want to ask yourself is that if all these people used to come to the hospital when there was no COVID-19, why is it that today a lot of people are not coming to the hospital? Is it that these people are now waiting for the conditions to get complicated before they come to the hospital? Is it that people who used to come for their monthly medications for diabetes, for hypertension, for asthma, and other chronic conditions are no more reporting to the hospitals? So we definitely would have to further pry into that and make sure that the norm is reestablished as soon as possible, or else we can face consequences that would be dire to the citizens in the Volta region. There are other preventive services that we render to the people of the Volta region. For example, immunization, very key. Attendance to some of these clinics have also dropped. Attendance to antenatal care has dropped in some instances. Our health workers are constantly trying to innovate. So they have the register of people who are supposed to come. Those who don't make it, they ensure that they follow up to them in their homes in the appropriate PPEs, wearing masks, going to see them to ensure that they are okay. They deliver that particular service to them. And most importantly, the health service is also putting in place measures. So in the past week, we've had a Zoom conference together with all the regions to see how we are going to continue to render appropriate routine service to all our people within the country. So we want to ask of every one of us to adhere to the preventive measures that we have spoken about severally on almost all platforms. Make sure that the appropriate social distance is maintained wherever you are, whether in the market, whether in a shop, whether at home. Wherever you happen to find yourself, just make sure that the appropriate social distancing is there. Not to forget when you are actually in a commercial vehicles as well. Wash your hands as often as you can with running water and soap. And in the absence of this, you can apply alcohol sanitizers. And watch out and make sure that it has actually 60% alcoholic content, at least 60%. And then use it to to apply it to every part of your hand. And there are these general measures that we are all supposed to abide by. We need to ensure that our immune system is at its best, is strong and potent. Eat healthy, exercise regularly. And with these few simple steps, we should, with a concerted effort, be able to prevent the further transmission of COVID-19 in the Volta region.